My name is Dr. David Noel. I'm trained as a dentist. And this is my daughter, Allison Dawn Noel. And Allison was born severely developmentally delayed and with severe retardation. Allie doesn't speak, and she's 13 years old. She's still working on her toilet training. And with regards to dental health and taking care of her oral hygiene, it's been quite an interesting path. And our purpose today is to describe how we got from the point at the beginning when we had to make decisions about how basically to take care of Allie's oral health needs to today, where she's extremely cooperative, and we feel that currently she's experiencing a great deal of success in keeping her mouth healthy. Allie was very combative at first, as many developmentally delayed people are, with regards to working on her brushing and flossing. She fought people off who tried to do it and would not cooperate. Our family has noticed that there have been many people who give up at that point, and they wind up just resigning themselves to taking their child in and having to have dental services done in the hospital or having special kinds of treatment done. But what we did with Allie is we basically worked on her with a gradient, where we started out at the beginning working with cleaning her teeth ourselves, and little by little she began to cooperate, and we just never gave up. Sometimes we had to use a rather strict regimen, other times she became cooperative. So we never gave up, and that's really the ultimate message.
Ali, te voy a lavar los dientes. Tenemos un Kleenex y primero limpiamos la nariz.
Well, Jovita takes care of Allie when she prepares her in the morning. She has to be bathed and dressed, and in that kind of pattern and that kind of regimen, Jovita found that by standing up, she could achieve the goal of getting to all the areas using the correct brushing technique and flossing. And that's really what worked individually for Jovita and Allie. That came well after the training that I did with Allie, which oftentimes was just Allie and I with the door closed and making it quite clear that Allie was not going to leave the room until she began to cooperate. So each person who intervenes develops their own role. Jovita came on the scene after Allie finally, if you will, capitulated and basically agreed that a daily brushing and flossing was the correct thing to do, and the particular technique that Jovita uses works for her. For me, I'm trained as a dentist, and when I work with Allie to get her teeth brushed and flossed, I prefer to have a real good access, a real good visual view, and I kind of like to check every now and then on how Jovita's doing and how Allie's oral health is.
We're demonstrating here some various methods that can be used, along with even such things as the dog. We have music therapy here, we have canine therapy, and underneath all this, we stress the hygiene aspects of this care.
Give him a big hug. Give him his kiss. Good job,
So
Maria.
the main message I would give is that the reward of getting somebody, really anybody's, teeth well brushed, correctly brushed, and correctly flossed every day or twice a day or whatever is needed and wanted by that person in order to eliminate dental disease is certainly far better than the kind of interventions that are needed by going into the dental office. Some people have to be put under general anesthesia just to have their dental work done. And that's certainly a terrible price to pay, as opposed to getting good brushing and good flossing and good oral hygiene. So the ultimate message, never give up. It's worth it to fight the war to get every person's teeth brushed and flossed well, so that the drilling, possible pain, possible restorative work that conventional dentistry requires to fix a diseased mouth is eliminated. Yes, preventing the disease is totally possible. Dental disease is a disease that can be totally prevented by brushing and flossing and appropriate care. So let's get rid of dental decay and gum disease so people don't have to have surgery to fix it.